welcome to Mother Care. My name is Marian and it's always a pleasure and privilege sharing the next half hour with you. It's all about the moms, the little ones, and everybody actually connected to taking care of kids. If you're a caregiver, then we definitely want you to be a part of this show. Today we'll be talking about something really important because it happens to everybody, but the big deal is that there's so many myths concerning it, what to do, what not to do, what happens, what doesn't happen. It's the big deal about teething. So today on the show we'll be talking to a doctor and we'll know what the myths and the truth about teething. But before we go into the doctor segment, we have a little feature on teething, and then when we come back, it's still Mother Care and it's still about the moms and the kids.
With the potential of being equally as baffling for a tried and tested mom as it could be for a first-time mother, the dreaded phase of teething, which ironically introduces us to baby's full beautiful smile, is a face most moms would wish they could wish away. Not clearly as understood as it is dreaded. The constant battle to deal with baby's new moods, the fevers, the possibility of resultant diarrhea caused not directly by the process of teething itself, but by the baby's desperacy to soothe the discomfort is truly a break from the norm, especially when we're talking about a very calm baby. On today's edition of Mother Care, we x-ray that feature of your baby's smile that always was there, yet when it chose to make an appearance, came with some hurt.
Alright, you're still watching Mother Care. Now, you know, a lot of moms, when it's the teething period, you have so many people giving you advice. I personally use the teething ring. In fact, I thought it was so cute. So some of them were like pink and blue and green. And I went all out for teething rings, the ones that were cold, the ones that were soft and all that. You had so many advice. Now, I would love to know what the real moms on the street did when it came to teething. What were those things they heard? What were the things they actually did when their kids were going through the process of teething? These are real moms talking about real issues.
At first, when they started running temperatures, they couldn't sleep at night. At times, if you give them breasts, they won't accept it and all that.
He has temperature and he has boil.
Me, the first sign I knew was when he was sucking, there was this thing. I felt one thing on my nipple and I felt there was something, so I just opened his lip a little bit and I saw the white thing coming out of it, and maybe there was a little temperature, like I said.
At times to be mild, at times to be very serious. I won't be able to sleep at night. Even the two of them, they'll be crying till daybreak. It got to a stage I thought they had malaria.
When I first saw the first tooth that day, I have a friend abroad whom we chat regularly about this. She also had a baby like a month after I had mine. I was like, yummy, my baby has. I've seen the first teeth, and she was like, hey, are you serious? I was like, yes. When I called my mother-in-law, I called my mom, I was like, oh, I've seen the first teeth.
But I noticed anything they pick, either their toys or anybody carrying them, they would like using either of their clothes or their toys to rub their gums. I believe the gums are itching them.
For every morning you wake up and you count. When I saw the third, I was like, okay, it's now 3. Then the fourth one, and now I have 4 up, 4 down. And I'm like, when I want to take this picture, I'll be like, show your teeth.
Some people used to tell me to get a teething ring for them so that I can be using it to rub their gums. But I don't really like that because it can easily fall down and at the same time put it inside their mouth. And from there, they can easily contact some diseases from there. And before you know it, they'll start pooing.
Well, it's a phase all mothers will go through. And the one thing I've learned about motherhood so far in my little experience, 10 months, is that stick to whatever you've been told at the hospital. When they tell you to do this, it is not because they are trying to promote anything. After all, they don't even encourage us buying drugs or anything. They say you give your child breast milk, make it exclusive. If you have the time, do it. If you can do it, do it. There's some people who cannot. When they give birth, maybe they have problem lactating and co. But some of us are lucky. Immediately we give birth, the breast milk comes, it flows easily. Give your child. You will see the difference.
The advice I used to, they would ask me to go and buy Bonabib, Pecan, different type of drugs, but I have to follow the instruction of the doctor.
Advice to them is to make sure their baby's environment is very, very clean, because that will prevent them from dehydrating. Because before you know it, they'll start pooping and all that. It's due to the germs they've been putting in their mouth. Because at this stage, anything goes into the mouth. Anything. And they don't know anything about being hygienic or not hygienic. Even if they see a piece of paper, any dirt, everything is directly into the mouth. So the mothers need to be very, very careful at this stage to make sure their environment is very clean, and anybody carrying them have to be neat.
A mother's love is the same in every language and every nation. Mothers have hope for their children. A mother's love has a will, but not always a way.
Welcome back. It's still Mother Care, and it's amazing what people think teething is. And it's always very refreshing to have the real moms talk about real issues that affect them. Now, I've got the doctor in the house who's going to be talking about teething, and she's going to be giving us a lot of education and information on teething. It's a pleasure and privilege to have Dr. Nkiri David from NIMR, that's the Nigerian Institute of Medical Research, here with us. It's great to have you on the show.
Thank you for having me.
Now, teething, it's amazing. I know it's a natural process, but every mom, I don't think I know any mom who doesn't get worried at that time, and we all have different solutions for it. But first of all, would you explain to us what exactly is teething?
Teething is the eruption of teeth. In other words, the coming out of the teeth in the mouth of a baby. Most babies are born without teeth.
Oh, wait. When you say most, some babies have teeth when they're born.
That's true. I'm sure you've heard stories like that.
You know, I thought it was just fables. Seriously?
No, some babies are born with teeth, but these are not real teeth.
Okay.
They are like buds that would fall off. And really, if a baby is born with teeth, it must be removed, because if it's not removed actively, it could dislodge. Maybe when the baby is feeding, and it could enter the airway and cause a lot of problems. So some babies are born with things on the gums that look like teeth, and they should be removed.
Okay.
But normally, babies begin to bring out their teeth from anything from the age of 6 months. Okay. But some early teethers could bring from as early as 4 months. Mm-hmm. So they begin to bring out teeth from 4 months, 4 to 6 to 8 months, usually. And I know that a lot of mothers have issues with teething, and some people even preempt the problem. In other words, they try to give something to make sure there are no teething problems.
That's because we hear so many things. You know, when you're a new mom, people have so much advice.
That's
you
true,
know?
That's true. So, issues, people talk about babies have diarrhea when they teeth. They have a rash, they have boils, they have a fever. But the truth is that teething is a normal process. The teeth are already formed just under the gums. The baby is actually born with the teeth. If you took an X-ray of the mouth of a newborn baby, you would actually see the teeth, under the gums. So when it's time, they begin to come out. And the coming out of the teeth is not associated with any problems. But I think because around 6 months, the baby is becoming mobile. The baby is beginning to sit properly, and then some are trying to crawl, reach out their hands and pick things around and put in their mouth. So it's around this time that they get in contact with foreign objects and germs. So they could come down with problems caused by the germs they've come in contact with. Not at the same time as their teeth are coming out. So teething has come to be associated with these problems. While in real fact, teething is a natural process that is not associated with any problems, apart from maybe some minor discomfort, because as it's trying to come out, there's some itching or discomfort around the gum area, and the child wants to put something in their mouth to chew on, to give them relief.
Okay, now that is so amazing because, yes, everybody associates, you just hear, fever, or they're teething, even if nothing is showing,
Yes.
Okay, that I just learned something right now. I just literally learned something right now. Okay, now, we have people, because of the idea that so many things come with teething, they have solutions.
Oh yes.
From teething powder to some of us use teething rings. What if I'm just uncomfortable? What I'm just thinking there's more to it? What are the do's and don'ts for
Yes,
teething?
thank you very much for that question. There is no need to give a child any medication. Medications are given for ill health. And we have ascertained that teething is not a sign of ill health. It's a normal process, so it doesn't require any kind of treatment. However, because of the irritation around the gum area, that the child needs to chew something or to have it scratched, let's put it like that. So you can use a teething ring, a soft plastic object that they put in their mouth. Make sure that it's clean, because what happens is they give this child the teething ring, it falls on the ground, the child picks it, puts it in the mouth, it falls on the ground again, it gets dirty. So that way a lot of germs get into the child's mouth and can cause all kinds of problems. So if you're giving a child a teething ring, you make sure that the environment where the child is very hygienic, very clean, and make sure you wash it from time to time. Then there's no place for powder. There's a particular powder that I've taken time to look at the ingredients, and you can't understand a word of the ingredients. It has so many things it's supposed to contain. All sorts of things that I can't even pronounce them. They're not English words. I don't know where they are from or what they mean. So I think it's dangerous to really give children some of these things. We don't know what is inside some of these things, and there's no need. Some other teething powders contain maybe paracetamol, or teething liquids contain paracetamol, or some other things maybe that will make a child sleep or drowsy or make the child lethargic. And these things are not good, because the first year is the time that the child learns so much. And the child needs to be alert as physiologically possible. So giving the child something to make the child sleep or become weak or lethargic really prevents the child from being alert to learn. Just like, they begin to speak at maybe from 1 year, they begin to say single words. And by like 2 years, they're making sentences. They learn all those things from the time they are born. So if you affect the child by giving the child something to make the child sleep unusually, the time to learn is limited, and they may end up becoming delayed. There is no need for that. And I want to point out that it's not even harmless, that some of these teething mixtures, some of them are quite harmful. Some of us will remember some 3-4 years ago when a lot of children in this country died because they were given some teething mixture that they didn't
I remember that. It was really scary.
So if a mother is uncomfortable, please bring the child to hospital. There may be some medical condition actually that it's not related to the teething. So it would be better for a medical personnel to have a look at the child. And then if there is another thing, we'll treat it. If there is nothing, we'll reassure the mother.
Wow. This is really, really good, because the issue with the teething mixtures and powders. People tell you, well, whatever, just use it anyway. But now it's good to know, don't. It's not even harmless. It actually has issues. So if you're so worried, stick with the teething ring like some of us did. We even put it in cold, but like she said, it's so important to keep it clean, because I had that issue of forever picking it up and putting it back in warm water, So if you're going to use it, please make sure that it is clean. natural process. That's what I like. It's
Yes,
a
it's a
natural,
natural
process.
process.
Still scared about the babies that have teeth when they're born, but still in my head. We're going to take a short break. When we come back, you've got loads of questions, and I know. And since I have a doctor in the house, I'm going to be able to grab 2 or 3 of the questions and have her answer right after this break.
Hello, welcome to your regular program, Mother Care, and of course your segment, Doctor on Demand. My name is Dr. Martina Agbere, your regular host on this segment. We have a lot of questions to be answered, but as usual, we take the ones that we need to just run with. All others will come in during the course of the program, maybe next week, but for now, we'll start with the ones that we have here. The first one says, please, I have wound in my breast. I gave birth 2 weeks ago. What can I do? She needs to know what to do. She gave birth 2 weeks ago, and she has a wound in her breast. From this, it's obvious that most likely she's a first timer. This is what we usually see often with people that just had their babies for the first time. Most times, it is due to the inability of not being able to breastfeed the child adequately, or putting the child in the right position to breastfeed. Anxiety, my first child, is the child going to feed very well? Is the child latching properly to the breast? Am I lactating? There's so much anxiety, and of course, from the fatigue of pregnancy. So what has happened is it's very possible that the child did not latch properly at the nipple. So that actually can cause the cracked nipple. When she said that she has a wound in her breast, oftentimes it's around the nipple region that you have the crack. And that is because the child wants to suck, wants milk. The child is hungry, but unable to get the milk because you have just latched properly to the nipple. And when the child does not latch properly or adequately to the nipple, you don't have that, what we call the let down reflex, that usually sends the mechanism through which the breast milk is released from the hypothalamus in the brain. So when you don't have that let down reflex, the child struggles to suck to ensure that the milk comes out, and the milk is not coming. So you can have a child being frustrated because the milk is not coming, and you can have a mother wanting to breastfeed the child, and the milk is not also coming. So what is the problem here? The mother needs to learn how to put the child properly at the breast. This is where the family comes in. The father can actually support. The mother, the grandmother who is also at home can actually support. Then normally you should put that child on the breast. You can actually support with the pillow. You can prop the child properly with the pillow so that the child can latch properly. Or you cross your leg. Just cross the leg adequately. Position the child. Ensure that you have proper eye contact with the child. If you have eye contact with that child, the child will be looking at you and the baby will begin to breastfeed. Then subconsciously and physiologically the milk will come out. That is just what we can help you with. Then what else can you do? That wound that is there, it's not as if you can't continue breastfeeding the child, because the moment you place that child adequately on that breast, the breast milk will come out. But the wound, you need to do what we call proper toileting. You clean that wound properly and ensure that it's kept dried. So you need to also alternate between both breasts. You let the child suck on one breast, then you move the child to the other part. Don't allow the child to keep sucking on only one part of the breast. That will help. Then you can also add what we call the lubricant. That's where you come with the Vaseline, because of the cracked nipple. You can put the Vaseline around the nipple so that it will be easier for the child to also suck. Then the next question is, I'm a young girl, but haven't seen my menstruation for 3 years. What do I do? What comes to mind here is she said she's a young girl and she hasn't seen her menstruation for 3 years. Yes, it's very possible. For a young girl, how old are you? Because some girls start their period from 8 years, some from 9 years, some from 11 years, some from 12 years, some even from 14. That is the one we talk about, the menarche. When did it start? If it's if it's at the early stage, it's possible. For somebody who probably started seeing her period for the first time, maybe at age 9 or age 10, it's possible that maybe you won't see the period for another 1 year or a couple of months before it comes again. But you haven't actually given us enough information here how young you are. How old are you? If we know your age, we'll be able to help you better. But let it be known that for children who got the menarche early, the period is not, the menses is not usually regular, it's not every month. If you come for like 1 month and stop, then we pick up again until it becomes regularized. But if for 3 years you're unable to see it, and depending on your age, I can actually advise you see a gynecologist. Go to the nearest hospital, try and see a gynecologist so that they can evaluate your hormones properly. So on this note, like I said before, the father, the mother is a family unit. Ensure that you keep the family closely knit, good health, monitor the children, give enough fluids, enough nutritional supplements, like you can give your vegetables, you can give your fruits, and of course the most important thing you can give to these children, water. Let them learn from you. Good habits will keep us going. Ensure you keep a healthy environment and your hygiene is good. Same time next week, we'll be back on your program, Mother Care, and of course on your segment, don't forget, Doctor on Demand. We're back same time. Have a pleasant week. Thank you.
Wow, today's show has been amazing because I've learned so much. I'm really hoping that somebody out there got something from teething today. Remember, no powders, no mixtures. It's natural. It's going to happen to every child, and it's a process they have to go through. And all those other things that come with it, it's not actually associated with teething. It's not. And I can't forget that picture in my mind of babies born with teeth. Okay, that would scare me. But I do hope you had fun today on the show and you learned something. So the next time you're going through it, take a chill pill, relax. The child's going to go through it and it will be a thing of the past. My name is Marian. Thank you so much for being a part of Mother Care. Next week, we'll be back, same time, same station. But till then, remember, being a mom, it's the best job ever.